Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and I've been practicing in the Scottsdale Paradise Valley area since 1992. All I perform is cosmetic or aesthetic plastic surgery. One of the more favorite procedures that I perform, and a very common procedure for me, is a rhinoplasty. I pride myself on my own patients that I have a very low, close to zero revision rate, but I often do revision rhinoplasties. That is, a secondary rhinoplasty on somebody who's had a previous rhinoplasty performed that they're not happy with the result. A question today is it better for me when I need a revision rhinoplasty to go to my original surgeon or to go to somebody who specializes in revision rhinoplasty? First of all, the main thing to understand with regards to rhinoplasties and revisions is there are generally two reasons why people need revisions. The first is, obviously, it's because the patient's not happy. But why is it that it didn't turn out to your satisfaction? I think the first reason is that probably that surgeon does not perform enough rhinoplasties to be adept at that. So I think when you're looking for a rhinoplasty surgeon, make sure that you go online and like their before and afters. Make sure you get an idea from reviews that there are enough happy patients that they perform enough rhinoplasties, and ask the doctor, how many rhinoplasties do you perform a year? So make sure that you go to a plastic surgeon that performs a lot of rhinoplasties. The second reason why people generally are unhappy after rhinoplasties are that there was not a shared common vision in terms of what a patient is looking for. You know, the days of patients coming in and being told what to do for a rhinoplasty in terms of, sure, I'll take care of it, that's what a plastic surgeon is saying, I think are over. I think it's very important when you come in to see somebody for a rhinoplasty that you have an idea of what you're looking for, that you bring in pictures of rhinoplasties or noses that you see in models to get an idea of what your taste is like. Also, I think it's important for the plastic surgeon to take pictures of your face, of your nose, and to modify them on the computer to my liking and to make sure that we're on the same page. And if we're not, we come to some kind of common aesthetic vision. In that sense, I think my revision rate is very, very close to zero. Now the question is, should I go to somebody new or should I go to my old doctor? I think it really depends upon your confidence in that original surgeon. If you feel as though that original surgeon that performed your primary rhinoplasty is skilled enough to make you happy, then I think you should go back to the original surgeon. Most often the case that I see is that people will go back and still be unhappy. Whether it is a complication surgically or you as a patient didn't voice ultimately what you are looking for. And let me tell you, don't be shy. I think you really need to tell the surgeon what you're looking for. Sometimes that will contribute to me seeing a patient for revision rhinoplasty. Now, revision rhinoplasties is a more complicated procedure than the primary rhinoplasty. Why? Because there's scarring, because sometimes I have to undo what was done before. So most commonly, when patients need a revision rhinoplasty, they will go see their original surgeon, get an idea whether they are comfortable with that surgeon, and then get some opinions from doctors that perform lots of revision rhinoplasties. I personally perform lots of revision rhinoplasties. So I think it really has to do with your idea of your confidence with your original plastic surgeon. But I think you should really take a look at some doctors that perform lots of revision rhinoplasties. Ask to see some photographs of rhinoplasty revisions so you feel comfortable that both of you are on the same page and that doctor is capable of executing what it is that you're looking for. I think an important thing is also is that if a doctor feels as though he can't make you happy, be comfortable if he says that, and then you should go on and find somebody else. So if there's any question, always call for a consultation. Thank you very much.